Melanie's story, facing infertility at the age of 29. A month after Melanie and Rodney tied the knot at 20, they embraced the decision to let nature take its course by discontinuing birth control. However, as time went by, the anticipated pregnancy did not materialize. "We just figured it would happen when it happened," Melanie shared. "It wasn't until 2 years of trying that I began to suspect something was wrong." At her yearly checkup, Melanie confided in her gynecologist. The revelation of low progesterone levels led to a prescription for Clomid. Meanwhile, evaluations uncovered Rodney's sperm mobility and motility issues. Seeking specialized care, the couple turned to a fertility specialist. Over the next few years, Melanie went through 3 intrauterine insemination attempts, one of which resulted in a momentary triumph before ending in an early miscarriage. The arduous fertility treatments left Melanie grappling with her emotions. "It was awful. I felt like I was riding an emotional roller coaster," she admitted. In search of answers, Melanie underwent a laparoscopy, an exploratory procedure in which a tiny camera is used to examine the uterus and the fallopian tubes. It revealed minor endometriosis, and some scar tissue was removed. However, it didn't solve her infertility. Undeterred, Melanie endured 3 more IUIs and 5 rounds of in vitro fertilization, IVF, each with disappointment. "Over and over, I would get pregnant, but the pregnancies weren't viable," Melanie shared, recounting 4 early miscarriages and an ectopic pregnancy. "These years were difficult," Melanie recalled. "It seemed like everyone we knew was getting pregnant. I have to admit, I was envious. I began to avoid going to baby showers." Amid the hardship, Melanie discovered solace in online support groups. "We're still in touch all the time. We chat at least once a week," she revealed. "I've even met a couple of the women in person. I'm the clear winner regarding the number of IVFs I had." Following her 5th IVF attempt, Melanie's pregnancy test yielded positive results. Yet, cautious optimism overshadowed her joy when she started bleeding, and her physician discovered that she had low hormone levels. They thought she might be having another miscarriage. However, this time the pregnancy endured, allowing Melanie to gradually embrace hope. Despite this, past disappointments made it difficult for her to fully relax and relish the pregnancy. "I was continuously worrying," she remembered. "I was subconsciously anticipating a miscarriage or a premature delivery." Aside from the worry, Melanie's pregnancy progressed smoothly. After 6 years of trials, Melanie and Rodney were finally rewarded with the arrival of Annie. "Annie is indescribably beautiful," Melanie beamed. "She was born with a lot of ginger-colored hair and cute, chubby cheeks. She is such an easy baby. She smiles and sleeps a lot." Even though Melanie was content, bonding with Annie wasn't without hurdles. Melanie confessed, "Due to all the hormones rushing through my system and the worrying, it took a while for us to get used to each other. I'd feel guilty that I wasn't constantly over the moon. I'd gone through so much to have a baby. Shouldn't I always be happy? But now we're settling into a routine, and it's hard to remember what life was like before Annie."